Live. Joining us on FaceTime this morning, we have Dr. Erica with St. Vincent Healthcare. And, these unprecedented times have caused some of the stress, worry, fear, anxiety, and so much more. So today, we're going to focus on mental health and suicide prevention. Now, suicide, is something we often hear about, but we might not fully understand the impact. So, Dr. Erica, do you have any statistics you can share with us so we can get the big picture on this?
Absolutely. There's some real sobering statistics on this important topic. First of all is that suicide is the 10th leading cause of death in Americans of all ages, but it's the second leading cause of death in 10 to 14-year-olds, 15 to 24-year-olds, 25 to 34-year-olds. And there's also been a 30% increase in suicides in the United States since 2001. And for the last 30 years, Montana has ranked in the top 5 states in terms of suicide rate. And a recent community survey here in Yellowstone County revealed that 1 in 5 Yellowstone County residents have considered suicide at some point in their life. Montana youth suicide rates in ages 11 to 17 is triple that of the rest of the country.
Oh, that's so sad to hear. I mean, these are, the young people in our community and feeling that would be the option for them. So what are some of the social factors that we can associate with suicide?
Well, some of the top social factors that we see as risks for suicide are particularly parallel to what's going on in our world right now with pandemic, which makes it even more concerning. So social isolation is one of them, social disorganization, and also a downward socioeconomic trend or mobility in people's lives, so financial stressors. Also, rural residency seems to be connected to suicide. 90% of suicide victims suffer from mental illness, so we really need to take away the stigma and increase awareness to major depression, alcoholism. And I did read too how alcohol sales have surged during this pandemic, and so I really try to screen that on my patients as well.
And, I know from experience, I've been pretty open about it, but getting help when it comes to mental health can be very scary step to take. So tell us, if there's someone watching right now who feels like they feel that suicide is an option for them, which it shouldn't be, who can they go to for help? There's resources out there, right?
Yeah, that's the good news, is this is treatable, and there are a lot of people out there who care and want to help people. So definitely get help. If you're depressed, or if you've been even thinking of suicide at one point, but you're not actively suicidal, definitely make an appointment with your medical provider and talk to them. At St. Vincent, we even have behavioral health counselors in many of our primary care clinics. You can get help right away with that. If you are acutely suicidal, or you're really worried about your safety, or you're worried about the safety of someone else, you just need to call 911. That is an emergency. And I also want to make people know about 211, which is for non-emergent issues that can connect you to a variety of mental health resources in the community, as well as other support resources for food insecurity or housing insecurity. And then there's the National Suicide Hotline that is 24/7. That's 1-800-273-TALK, as well as texting TALK to 741-741. And all of those will get you connected right away with someone to talk to and help guide you through this and keep you safe.
Just take that first step and everything gets much better from there. And let's finish off by quickly talking here about an upcoming community event.
There is. St. Vincent is one of the sponsors of the Suicide Prevention Awareness Weekend that's coming up September 25th and 26th. And this is a public event that you can sign up for. There's an online conference looking at suicide prevention on that Saturday. And on that Sunday, they have scheduled a really neat, important event with a showing of the movie Not Alone at the Babcock Theater, followed by a panel conversation with some really important panelists and people who've experienced this, or mental health providers. And you can find more about that on the website for St. Vincent, or just looking up Suicide Prevention Conference in Billings, Montana.
All right, Dr. Erica, thank you so much for taking the time to speak with us about this very serious and important topic, and we will see you next time.
Happy to be here. Thank you.
Thank you. We'll be right back after the break.